Good morning, Mr. Chair and Commissioners. I thought I had a pretty quiet voice, so. Okay.
No, we just want to get to make sure we're heard out there as long as.
Absolutely. So I handed out the numbers again, our COVID cases, and on the two-page handout, we have the Clay County numbers as well as the Minnesota numbers. So Clay County has positive cases of 799. That was as of August 17th. We still have 40 deaths. That's been consistent for the last few weeks. 744 that are out of isolation. And then the Minnesota cases, there's 65,716 with 1,712 deaths. And there's 58,859 out of isolation. So as you look at the numbers on the back of, you can see our confirmed cases by the testing date, and those no longer needing isolation, and number of deaths. So right now it's 15 active cases, and that does fluctuate as they add more cases on and off, but those are the number of cases that we are following up with. We also have worked with, I mentioned I believe last week, that there were some issues with phone numbers and not being able to follow up with some of the cases and some of the contacts. So we've been working with Sanford to kind of make sure that they're ensuring that they get the correct numbers, and they have been, but there's been, I think, some, I'm not sure exactly what the glitch was, but there was some issues that hopefully will be resolved and we can follow up so we don't have cases that are sitting out there that we haven't been able to follow up on. We also have our 14-day case rate per 10,000 people. That's a number that across the state we've been using to help schools make a decision, K-12 schools, about what kind of, are they going to be hybrid or in-person or totally remote. And so our number in Clay County right now is 9.87. So it's below that 0 to 10 rate. So schools can make a determination whether they want to be in classroom. That is a rate where they could do that. This will change. We'll have updates probably every Thursday on this number. So schools can still decide. So if this number goes up over 10 again, it's, you know, they don't have to change their plans each time it goes up unless it really spikes. So if they make a decision about the their learning model, they can go with this number. And it's not just the number. They also have they had to create plans about how they're social distancing, masking, how they're serving meals. All of that comes into play. So this is just one of the components of how they can make decisions about their school. So in fact, we just had a meeting this morning. It's still going on with one of the schools that really wanted to talk through all of their plans with us, as well as looking at the 14-day case rate. So we're still working with the K-12 schools, and oftentimes they'll call and make a request to have a meeting with us and discuss kind of all the things that they're incorporated and how that's going to work in their school system.
Kathy, can I ask you a question
yes.
on that? So that guideline is by county then? Can they break it down into actually school districts, or?
No, they said the number would be not accurate if they broke it down
because
into
you're not
school
certain
districts.
Of locations. Okay.
I did give them just a general idea of the number of cases since we started this in March. About, you know, the majority are in Moorhead, and then there's some of the outlying areas have very few cases, but they're looking at it as a whole. For the county, so they really want them not to focus on individual school districts, but as a county, what we're seeing. Right. They'll also be, you know, paying attention to the Fargo side, just because we're one metro area. So they'll be looking at, just as a comparison, how do Fargo numbers look for their reopening of schools?
Kathy, I have a question.
Yes.
Yeah. What is the, as of yesterday, I think I looked at it, what were the number of people that have been tested in the state of Minnesota?
The number,
total number.
Let's see, The reported number of tests, I believe we have.
Didn't it just go over 1 million?
Oh,
I thought
excuse
it
me?
was 2 million.
I think I thought I had the number of people tested in Minnesota.
Yeah, it's on our sheet. It says 1,266,561.
There we go. Thank you.
And then how many have we have tested in Clay County?
We just don't have that number of how many were tested exactly, so.
Because a lot of those have probably been tested over in Cass County.
The majority get tested through Sanford or Sencha, some through Family Health Care if they're a patient, or Family Health Care does a lot of the underserved populations and homeless populations, and so they have a number of people that they're testing there as well. Any questions on the numbers?
So if on this, kind of to follow up on Commissioner Haney's question, on 8/16, the number of completed tests from Minnesota Department of Health, Public Health Lab was 77, and then the external laboratory tests were 12,613. Would that include Cass County, North Dakota, or those external laboratories in Minnesota?
External in Minnesota.
So only Minnesota,
Yeah,
okay.
only in Minnesota. Yeah, so they're doing a lot of external labs. North Dakota as well is doing external labs. I know that one of the health facilities is using Mayo Lab in their as a laboratory for their testing. So there's a variety of other external labs that they use as well, both in Minnesota and North Dakota.
So as we move forward and hopefully never have to deal with anything like this again, but if history repeats itself, we should probably be prepared for that. I think it's very important somewhere down the line that there's been a gap in data that we've been able to receive because of the border issue. And I know there's other cities in the state that deal with that, but we need to know, if we ever deal with this, what happens with Minnesota residents and North Dakota laboratories or North Dakota tests. And so, I think we should definitely bookmark that as a conversation piece to figure out how do we get that data, because this is great and it's fine, but you're really missing a chunk of our data. And then on the flip side, the North Dakota is getting the reports on a lot of Minnesota residents as well.
Yeah, that's a very good point, Commissioner Mojo, and we did talk about that with our Red River Valley Task Force. So some of the things, lessons learned and better processes will be that that information can be shared in a short period of time instead of a lag.
Can I have a follow-up to that? So on our front page of the 2-page where we have the Clay County, where it has the positive cases, so I'm assuming right now that our places in Fargo that do the testing, whether it's Sanford or Essentia, they're only sending positive information to the state of Minnesota. Is that correct?
Now they are sending negative results as well.
Okay, so that goes to,
yeah,
that
they've
can
worked out a
help.
plan, but we aren't getting that, but they've worked out a plan where they're sending the negative results. So for Minnesota Department of Health to sift through all that, it's a very time-consuming, it's not an easy shift over to a system.
If those negative results are now being reported to the state, I think we should request we want it.
And
and that goes to exactly what Commissioner Moser was talking about, so that we get an accurate idea of how many people from Clay County were actually tested.
right, and they're working on that plan. I've worked with the infectious disease expert and also our epidemiologist that we would like that information. Just takes them a long time to congregate it or aggregate it. So we'll hopefully get that information, and then we'll have more information to share.
Thank you.
I think that it would be very good for us to have this known, what the actual rate of people testing positive in the state of Minnesota and in Clay County is. And just doing the basic
Right.
math, about 1% of the people of Minnesota have tested positive so far. And in Clay County, about 1.2% have tested positive so far.
Right.
But we never hear those stats.
Yeah, so good information for us to get from the state and to have to share. So also I talked we talked last week or the week before about the pilot studies. And the 4 states are Florida, California, Minnesota, and North Dakota. So we're the 4 pilot program states that the federal government is going to work with. And they'll work with the state public health department, immunization department, and the state emergency systems to design and execute a plan for this pilot program. They're considering this COVID vaccination to be most likely the largest vaccine campaign that we ever have experienced. So they're going to be working, we don't have any details of that yet, but those are the 4 states that were picked for this pilot program. So it'll be interesting to see how this plays out. They have determined that we need at least 70% of people vaccinated to develop herd immunity, and that's not an uncommon percentage. We've talked about that before to get the herd immunity. We've talked about that with influenza as well. So 70% of the people in order to develop a herd immunity. So we'll hear more, and as I get more information, you know, there'll be a lot of planning at the state agencies in regards to those pilot programs and how that's going to look. So more to come, and it will be when the vaccine, of course, is available, whether it's the end of this year or the beginning of next year. We'll find out more information as they work through that process.
That's about 217 million people.
That's a lot of people. I think we'll need a pretty large space to get everyone vaccinated in a short period of time. We expect a big lineup for that vaccination. We also have talked about the influenza vaccination, and there's a big push for us also to get that influenza vaccination out to the general public, because we also want them to have that prior to getting the COVID vaccination. So you've probably also heard across the nation that we're seeing clusters of cases as the higher ed is opening up. So we're watching to see how that's working. It's you know, social distancing can be part of that issue, not wearing masks, and of course if they do a point prevalence testing before these students go to higher ed, they're only getting the positive or negative test for that day. So if you don't do the ongoing serial testing, you're not going to be able to track that. So they really are pushing the social distancing and masking, and that seems to be kind of the issue for a lot of these clusters of cases. And then living in the dorms, I mean, it just kind of is a setup for not being able to be social distance. So we'll watch as universities open up to see how that's going to play out. We still in Minnesota are not going to be doing a point prevalence testing for higher education. And you maybe have seen on the news where they're doing that in the North Dakota higher eds, but in Minnesota they are not going to be doing that.
Do the local universities here, are they going to be offering alternative, or is it all going to be in class?
We have not, I mean, I think some of it's going to be kind of a hybrid model as well. Okay. I've heard through the grapevine that there's going to be some online classes and some in-person classes, okay. So we don't have the very specifics, although we've met with them on a couple of occasions, but they're still working out the details of how they can keep the social distancing and masking with some of those classrooms. So we'll find out more as they open up. There was also some questions previously about the immunity. If you get COVID, what kind of immunity do you have? And CDC initially put out that there was some immunity for 90 days. They've retracted that now, and so they're just saying the science is not showing that you can keep an immunity for 90 days. So they're not giving out a time frame, because we get that question a lot, is how long, if I'm positive, do I have immunity? And the reality is this virus mutates, just like the influenza virus. So it may, your antibodies that you build up, it may not recognize a repeat invasion of the of this virus. So we cannot say with any science backing it that you would have immunity for 90 days. So there's some, like measles, for instance, or chicken pox, that typically lasts a lifetime for immunity, but this family of viruses, like the common cold and COVID, it's just not the same. And so you can, it's maybe unlikely, but you can get COVID a second time. You can test positive even after you've recovered. So we just want to dispel the myth that you actually have this immunity for 90 days. They're not sure. They're still doing more studies on how long that immunity lasts.
So how do they come up with a vaccine for a virus that continues to mutate?
Well, the same with the influenza virus. You pick the worst strains that can cause the most illness, so the strain that's been circulating, even though it will mutate, it will still provide protection. Just like influenza, if you get the influenza vaccine, you could potentially still get an influenza virus, but it will be a lessened, because some of it is covered, of course. So it protects you. Influenza, they say, it will protect you hopefully from hospitalization and death. And that would be the same with COVID. We're getting they're working on the virus that will
reduce the severity.
Correct, reduce the severity, exactly right. Yeah. Any questions on that?
Just a question, if you have the number of COVID patients in the FM area hospitals?
No, we got that number last week, but they have not provided it this week. That's another thing we're working on with Sanford and Essentia to get us those numbers weekly, so they can provide us with how many are in ICU. I'd like to have the numbers in ICU and the numbers of hospitalized for our Minnesota numbers. So we're working with the two officials on the Sanford and Essentia side to get those numbers. And we need to get them weekly, hopefully, so I haven't received those yet this week. Any other questions on COVID cases? Okay, thank you.